I believe that a healthy community is comprised of individuals, families, neighborhoods, businesses that take good care of themselves, that are kind of whole in and of themselves, that have the resources to do that, and then have both the desire and the structures in place to reach out and support one another. I believe that the more we structure our communities to be healthy, both physically, mentally, getting an education, having great jobs, having a strong workforce, and that we do that together with each other and talk about it, I believe that's how we become healthier.
BRBSN 3E Group 3A. I am Mark PABILLO, and together with me are my research team, TRISHA NICOLE LOPEZ, QUELLA ANDREA MAHILUM, CHARLIZE REYANNETTE NICASIO, and DEEN OQUIANA, and we present to you our study entitled Level of Awareness and Utilization of Public Health Programs Among Community Clients.
The community's degree of understanding of the wide range of public health programs offered in the barangay will be our first focus. The absence of individual citizen knowledge concerning health services presented challenges for barangay health workers in their role as community health workers, according to Yamaguchi Y et al. 2023. Knowledge of the current program usage environment is crucial because awareness alone may only sometimes lead to inefficient use.
This research will assess community clients' public health program in the barangay awareness and use. This study will contribute to the corpus of knowledge on public health and will provide a foundation for evidence-based policymaking and program creation. Ultimately, our research aims to facilitate the creation of more inclusive and effective healthcare system. For the research design, this study will utilize a quantitative correlational research design to assess the level of awareness and utilization of public health programs among community clients. This is the preferred research design because it entails observing the statistical relationship between two variables, which are awareness and utilization of public health programs, wherein it involves numerical and investigation whether the variables correlate. If there is any correlation identified, the direction thereof, and the strength of correlation.
The participants of this study are the residents of Purok Santa Clara, Barangay Tabunan, Bago City. A total of 103 households was obtained for this study. Cochrane's formula was used by the researchers in order to obtain the sample size with a 5% margin of error and 95% confidence level. It was determined that with a total of 103 households, 81 participants was the sample size of this study. Furthermore, non-probability sampling, specifically the purposive sampling, was used. Certain requirements was met, which is that only those income-generating individuals was surveyed.
And for the questionnaire, the study utilized a self-made survey questionnaire to assess the level of awareness and utilization of public health programs among community clients. The questionnaire was divided into 3 sections. The first section will include the instructions in answering the questionnaire and the respondent's demographic profile. The second and third sections will answer the level of awareness and utilization of public health programs among community clients, such as family planning, prenatal care, immunization, deworming, TB dots, and rabies. A 4-point Likert scale was used to measure the level of awareness with numerical and verbal interpretations of 4 for very aware, 3 for moderately aware, 2 for somewhat aware, and 1 for unaware. A 5-point scale was used to measure the level of utilization of public health programs. For the validity of the instrument, the self-made survey questionnaire and determined the level of awareness and utilization of public health programs among community clients was critiqued by 3 validators. This utilized the Gooden's-Gates validation rating scale. The validity score from the 3 validators yielded an average score of 4.85 and was interpreted as excellent. For the reliability of the instrument, the reliability testing was conducted among 30 participants, which were the community clients of Barangay Dulao, Bago City. The instrument's reliability was examined and tested using Cronbach alpha test. The researchers acquired an alpha value of 0.899, which implied that the research instrument is reliable.
Now for the results and discussion. The demographic profile of the community clients based on age, sex, civil status, monthly income, and length of residency in the community. Based on the results, most community clients who participate in this study are those with ages 36 years old and above, female, having a civil status of married, earning below 11,000 pesos, and residing in the community for more than 20 years.
The level of awareness of public health programs available at the barangay health station among community clients when taken as a whole and grouped according to demographic profile. The result shows that in community clients ages below 36 years old, married, earning 11,000 pesos and above, and residing in the community for more than 20 years are very aware of the public health programs available at the barangay health station than those community clients ages 36 years old and above, female, single, and widowed, has a monthly income of below 11,000 pesos and residing for 20 years below when grouped according to demographic profile. As as a whole, out of 81 participants, the majority of participants are very aware of the public health programs available at the barangay health station.
As for this table, the result shows that the level of utilization of public health programs available at the barangay health station among community clients, when taken as a whole and when grouped according to demographic profile, is moderately high. As for the level of awareness, the results presents that the community clients are very aware when it comes to immunization, deworming, and anti-rabies or anti-tetanus shot as an available public health programs in the barangay health station than those programs about family planning, prenatal care, and TB dots.
Results indicate that high utilization occurs in both immunization and deworming, followed by family planning, prenatal care, and anti-rabies or anti-tetanus shot, which shows moderately high utilization among community clients. However, TB dots resulted in low utilization.
There is no significant relationship between the level of awareness and utilization of public health programs available at the barangay health station among community clients at a 0.05 level of significance. Results shows that there is no significant relationship between the level of awareness of public health programs available at the barangay health station among community clients and their demographic profile in terms of age, sex, civil status, monthly income, and length of residency at a 0.05 level of significance.
Significant relationship between the level of utilization of public health programs available at the barangay health station among community clients and the demographic profile. Results shows that there is no significant relationship between the level of utilization of public health programs available at the barangay health station among community clients and their demographic profile in terms of age, sex, civil status, monthly income, and length of residency at 0.05 level of significance.
In conclusion, the study examines public health awareness and utilization among community clients in Barangay Tabunan, Bagu City. It found a moderate level of awareness but low utilization rates. This highlights a gap between community engagement and policy implementation in the Philippines. Addressing barriers to access and improving information dissemination strategies are crucial steps to bridge this gap. Targeted efforts are needed to reach marginalized community and understand demographic differences in awareness and utilization. The findings have significant implications for public health policy and practice in the Philippines. And for the recommendations, the study suggests that improving public health programs in the Philippines can be achieved by developing community engagement strategies that involve local leaders, healthcare providers, and community members. These strategies should prioritize health education and awareness campaigns, improve access to healthcare services through mobile health clinics and community health centers, and advocate for policy changes that address social determinants of health like poverty, education, and housing. Strengthening the healthcare system and allocating resources to public health initiatives are critical steps in improving health outcomes and reducing disparities. By implementing these recommendations, public health practitioners can increase awareness and utilization of health programs, ultimately improving health outcomes in the community. Future researchers should identify additional barriers to public health program awareness and evaluate the effectiveness of interventions to facilitate continuous improvement and innovation in public health practice. The research study's findings will help administrators, student nurses, the Department of Health, nonprofit organizations, community clients, and future researchers. The researchers, who are also nurses, will share the study results with the barangay health workers and barangay officials so that they can improve their methods of reaching out to the barangay's far communities to ensure that they are aware of and use the public health programs available in barangay health station, allowing them to expand the platform providing healthcare services among community clients.